Isha. It's a pleasure being here with you. So delighted to be a participant in this very important event.
Thank you. So could you tell us what is the outline of Saudi's digital transformation in the post-pandemic era?
Sure. Well, first of all, I'm not wearing the Saudi uniform because I'm not in the kingdom right now. But if you ask anyone who's in the kingdom on how the COVID changed the whole country, the answer would be clear. And it is ironically funny to say that if there is a third booster for COVID that will raise the immunity system for people, I think COVID itself was a very big booster for technology adoption. Many people have accelerated their digital transformation initiatives. They have accelerated the way that people adopted their projects. And many people have already moved from the traditional way to the digital services and products. And the reason for that, I think, comes under three main things. One is, of course, there is no choice. People who were studying the digital transformation initiatives and the ROI on it, and whether we need that or not, they had no choice, because if you don't go digital, then you will stop working. This is number one. Number two, which has clearly changed during the COVID time, is the increase in funding. Organizations that are not heavily relying on IT or not really giving it much of an importance, they realize that, okay, it is really crucial now to increase the funding, to give a good budget for IT. The third one, I think, is the reduction of barriers to adopt the technology. Again, if you don't have many choices but to adopt technology and to start using it, even people and the way they look at technology and adoption of new services will change. The resistance of people also will change. The adoption will be more easy. And if we can highlight on what happened in Saudi, there is a lot of cases, but for the sake of time, I will just go through three major government agencies or government ministries that have done amazing things that would not have been done ever if COVID was not there. One of them is 𝐃𝐢𝐠𝐢𝐭 app. 𝐃𝐢𝐠𝐢𝐿 is giving a virtual consultation for people when they are at home. It is not a fully diagnosis service, but at least it can give the service for the people who are locked down, who cannot go, who don't have emergency case to go to the hospital. The app give them the ability to consult a doctor online and to have a face-to-face and a video conversation, and to diagnose and to give instructions on how to treat themselves. In terms of the Ministry of Justice, really amazing thing that happened. The platform of having the whole work of Ministry of Justice during the lockdown to having it online was amazing. 2 million users registered in that platform. There was 70,000 daily use of the platform. There were 18,000 hearings in the court almost every day, and more than 1 million requests has been done virtually. So if we look at the pre-COVID, all of those services, especially with Ministry of Justice, when you need to have verification and you have people in person and to double check their identities, would not have been possible at all. Another third example that the government has done, which has tremendously a big transformation. And again, this is one of the things that have been done because there were no choice, was the e-learning platform. The Ministry of Education has launched an e-learning platform that has registered 5 million students. There were more than 2 million assignments. They were released and graded electronically. There were more than 90 million virtual classes that have been done on that platform. Even though that idea was there, even though people would think about e-learning and virtual schooling and stuff like that, without having COVID, this project wouldn't be live at all.
Okay, so you've highlighted for us at least 3 areas. One is doc consultation, one is virtual course, and one is virtual classrooms. You said these would not have happened had the COVID not, the pandemic not happened. Now, could you then give us any more examples of things that have changed because of the pandemic? And in your mind, what's the future course? Will virtual classes continue in the future as well? Are virtual courses more efficient? So will they also continue in the future?
Yeah, sure. For schooling and for virtual classes, it might not continue all to be online. For example, the next coming schooling year, it will be divided. The students who got vaccinated will be on site. Students who were not vaccinated will continue online. So having that platform ready will give you as a government the flexibility and more choices to deal with that. Not all students can take the vaccination, but all of them have to take the education. So you have to have choices. Even in higher education, we already seeing flexibility and adoption of e-learning. We have 1.4 plus million students who have been taking college classes online. And I think more than 5 million exam or quiz have been published and taken online. So even though schooling people would argue that it has to be on site rather than online, but at least you have the infrastructure, you have the platform, you have more choices as a government to offer for any case that you can deal with.
But do you think that something that you've learned during this crisis time has proved to be so good and more efficient than what it used to be in the past, that you would like to continue in the future? Has there been any kind of digital transformation that you've seen that has the propensity and the use case to continue in the future?
Sure. This is a very, very interesting and genuine question, because everyone was pushed to go digital. Everyone had no choice. They have to run online and have offering of digital products. And while people were doing that, organizations and businesses realized that, okay, we have really good use cases. Even though if COVID was not there, we have good use cases that we could continue and embrace for the future. And I would say we have two, let's say, pillars for that adoption that I expected to continue and to evolve in the years to come. One is the way the employees are working in their organizations in terms of the structure of the organization itself, in terms of planning for the workspace of the offices. We have seen many employees, they really favor having to work online. Not all jobs are good to have them online, but many people, they were satisfied, the employees were satisfied to have their job online. They had much better balance in life between, working at home and their other stuff. and employers also would really plan differently in terms of workspace, in terms of later on in the future, the allowances and the commuting from home to office and all of that. We have also seen that many jobs are not required to be full-time and on-site. Many jobs and many activities that could have been done part-time and could have been done by freelancers who work overseas. So this is opening up a broad way of embracing and enrolling people from all around the world in the organization without having, them going through the traditional way of work and contracting and all of that. So this is again a flexibility in the workplace and the flexibility in the organization structure that I believe will continue. And we have already seen the big companies like Google, they have already implemented that as a normal routine for employees to have certain percentage of them to work online even after the pandemic. We have another side of the story that we have to look at. If we look at the business side, businesses, they have to adapt with the new norm. The new norm was in the pandemic that everyone would like to have all the products, all the services they would like to buy online. So if you are a retailer and you don't have, if you are not offering a good electronic services, then it is difficult for people to buy your products. No matter how good the product is, no matter how big the business or how you are having a lot of retail stores and a big network, if you don't reach the customers very well, if you don't give them a good experience, many other products which might be lower in quality or lower in or higher in price will get in, and people got used to this new norm and to buy and interact with the retailers online. At the same time, it has opened the door for new businesses and new startups to get into the market. So if anyone who's interested in a certain kind of business, they might kick it off and start running it online without having to worry about the fixed cost. There would be no place to rent. There would be no people to interact with face-to-face with customers and all of that. So these are two sides of the business side. The decrease of the operation cost, that whenever you adopt good technology and good use of mobile apps, and the accessibility and reachability. If people are not able to reach you, they got used to have everything online. So you might lose some of your business.
All right. How does the utilization of e-health in the Kingdom of Saudi Arabia and digital technologies help in the public health response to COVID-19? And do you think that digital transformation can help in the safe return to normal life, like the pre-pandemic days in the Kingdom? Will it help?
Definitely. One of the good things that has happened when the COVID broke down in the Kingdom was the adoption of or the collection of data from early days. And without having that, it would be really difficult to deal with the pandemic. I would give a couple of examples that has really helped in controlling and limiting the infection and not having decisions that go nationally. One of them is to have digital mass testing. So whenever people are going for testing of COVID, that result would be digitally recorded that individual will be recorded. The application that the individual is using will immediately reflect their status, and all of that data will go back for analysis and for studying. Studying the areas that have have high rate of infection, and we have seen some areas would go on lockdown, like Mecca area, while other areas still not locked down. And we have seen lockdown that's covering the whole country, but without having digital data and digital testing, and without having that data reflected on individual devices, it would be difficult for the government to make decisions on, okay, which side is having more infection, which side of the country is having more infection, what decisions we have to make. When are we going to open stores? When are we going to close the stores? Also, another use of technology that has tremendously helped in dealing with cases that really need to go to the hospital, for example, or to have a permit to process the logistic services and grocery stores and all of that. So there was an implementation of a permit, electronic platform to release a permit for people who are permitted to go out during the lockdown, for necessary work like medication, groceries, and stuff like that. When we look at the quarantine, also, it is very crucial. The quarantine is one of the main things that the government need to control to stop the spreading of COVID. And we are now seeing that for people who are coming overseas into the kingdom, they would go in quarantine for 14 days. So that also has been done digitally, and we have seen really good control on that. And we have seen that whoever is breaking that, the government was able to contain and to bring back to the quarantine site in order to stop the spread of infection. So, in summary, it is all about that. If we want to have safe return to life, if we would like to have a better control on what's happening on the ground, we need to have real-time data that is reflective of what is really happening in different areas of the country.
Okay, and when you return back to pre-pandemic days, this is going to help you, especially with vaccination records, movements of people. Do you think this extension will continue when in the future people return to normal life?
I think the infrastructure will be there. I think the infrastructure will be used for other services, not necessarily to services that you have seen during the COVID. Hopefully, we will not have another breakout of another pandemic. But in case that happened, the infrastructure would be already there, and we would be ready to use them. But we have seen, for example, an Sahati app that has been used initially for vaccination, for registering people to vaccinate and to filter people when there was a shortage of vaccination. It was very convenient and very easy to filter people based on their age and based on their health condition, and to give them appointments to go to the vaccination centers based on that. That without having the data in hand, without having the digital channels in hand, that would be really difficult. And even after the COVID is done, the app will continue to be used for other services, like booking appointments to go to the hospital or the primary health care, or to take general exams or tests for managing population health and stuff like that. So building the infrastructure and having a platform that people has already interacted with will give a leverage to even offer more services and more interactions even after COVID.
Yep, that's very heartening, and congratulations for having that infrastructure in place, so that in future also, at least citizens will be at ease. Thank you so much for sparing the time to talk to us, about how digital transformation is already underway, the kind of benefits it's brought to the lives of many citizens in many things like healthcare, education, even the justice system. Thank you for joining us today and sharing with us your experiences on digital transformation. And all the best to you for the future as well.
Thank you. It has been a pleasure. Thank you. Appreciate that.